And hello, everyone. Welcome to your community convening today, the RWJ of Health Equity Speaker Series. We're really excited to be with this group of leaders and community and families. Like my favorite part about the speaker series and the healthy children and family theme that we get to collaborate in this moment. Our topic today is leading with strength, advancing health equity in a shifting landscape. And whether you're with us live today or you're watching it later, it's been a little whiplashy these last couple of days, hours, months, years. So I'm looking forward to hear from these leaders today. And so I'm Dr. Toni Lewis, president and founder of Liberation Health Strategies, a family doc and geriatrician, but really just a multi-hyphenate blackity black woman out here who just likes to honor the many organizer women in her family. And so, with that, as I was meeting your esteemed panelists today, we were talking about how sometimes the thing that really drives us, the thing that really moves us about our leadership, about how we move in the community, about what we define as strength, is not really in the bio. And so I'm going to kick it to my colleagues, my newfound fam, to talk about what is it that's not in your bio. And please, give us your receipts at the top. People love that, and you've earned them. But what is it about that's not in that bio that really calls you to this work? And so I will say, who wants to get started?
I'm happy to kick us off.
Mm-hmm.
Yeah. All right. Good afternoon, everyone. My name is Aurora Harris, and I am the Senior Director of Regional Strategy at Young Invincibles. And so I oversee our California, Colorado, Illinois, New York, and Texas-based policy advocacy campaigns. And Young Invincibles, we're unique in that we don't do anything about young people without young people. And so our campaigns and our groundwork is youth and young adult led. We work with young people ages 18 to 34 on healthcare access, affordability, equity, all that good stuff that we care about on the call. And what's not in my bio that brings me to this work is my mother and my relationship with my mother. She was diagnosed with lupus in her 20s, and I watched her work my entire life with a chronic illness. Um, and I watched her work without access to affordable health care, and I watched her have to fight for over 5 years to finally get disability and be able to sort of get disability rights and disability income. And that really opened up my eyes to how broken our healthcare system is for women like her. So that's not what's in my bio that brings me to this work. And I will pop it over to Dr. Donahy.
Thank you so much. My name is Donna, or you can call me Donna. And well, my inspiration to be here today is actually my parents. They were always good with people. And but funny enough, my dad said, "Okay, we have a doctor at home, an MD. We have an architect, an engineer. We need a lawyer or an accountant." I said, "Lawyer?" And he said, "No, you're an accountant." So uh, for we're talking about equity and everything. So he said, no, women should not be lawyers. You can be an accountant. So um, I saw how they were helping all these other people. And for personal reasons related to health, I ended up in public health, something that I would never, ever thought that would land there. And that happened almost 30 years ago. And now I'm here and I love it. And I believe, strongly believe that the hand of God led me to where I'm at. And I guess should go next.
Donna, do you want to give us a little bit more of the headlines about your traditional credentials, where you are, and what you do?
Yes, I'm sorry. Thank you. So I am, and sometimes I say, well, I read all the bio. I want to know more about you. So thank you. So I am right now, I'm the founder of Trust CHW, which is a truly a community health worker. That's what it stands for. CHW is Community Health Worker Promotores de Salud, and is an organization totally led by community health workers. And these community health workers, they were actually, they were very good funded in university, but they asked me, you're leaving this university, going somewhere else. Can you help us create an organization? So I help them, and they're the ones leading it. And I've been doing that in the past 5 years or so. But actually, this work with the community health workers started 20 years ago. So we had Texas was the first one on getting the promotores, that's a community health worker certification. And since then, I've been working with them. And now is what we were visioning that it will happen is happening with this group of fine people that they're actually from the community. Thank you.
Thank you. Thanks, Donna. I so my name is Sean Fitzpatrick, and I'm the executive director of a nonprofit organization here in Houston called the Jung Center, and it's when I'm talking with funders and people in this in community health spaces, I'll say we're a psychoeducational institution working at the intersection of mental health and the arts. And in a given year, we have more than 150 public programs. Many of them are available online. You can participate online or in a hybrid fashion. We also do more than that. Actually, more of the people that we serve are out in the community, and a special population that we work with consistently are people who interface with suffering in some way, and with human suffering. Both people who are interfacing with trauma, but also broader forms of human suffering. And I would say that what's not on my bio around this has to do with the personal call to do that work with people who are touching human suffering. It's comes from a couple different places. One of them is work that I've had the privilege to do for the last 7 or 8 years now in Haiti, helping to build community mental health infrastructure there, and trying to, alongside that, build an eye on resilience, which is a complicated word for me, but and the person's own needs as they do the work, because it's very often the case that we lose ourselves along the way as we do this work. And I find again and again and again and again and again and again that when we're doing this work, we're led by our values, and maybe sometimes led by our lived experience. And we are just as essential to the work as the people that we're serving. So that's my story.
So I already have like 15 follow-up questions for all of you. Know that we're going to come back to this topic of the stickiness around the word resilience, because I have certain people, a couple in the audience, who are like, "Don't you ever use that word," you know. I would love to hear from all of you again your geography that you're covering, because it feels like, because you listed a few states, Aurora. Sean, I think you listed that there's a virtual component and a couple of things, and I think you all are all physically in Texas-ish right now, right? Kind of, sort of. Okay. So could you share with our audience? Because I think as we get into shifting landscapes, like states matter, right? In terms of what's going. So what were your states again?
Yeah, I'm based in Houston, Texas,
Mhm.
and we work in California, Colorado, Illinois, New York, and Texas.
Okay.
Yeah.
And we are based in Texas, and the certification that we have is for the state of Texas. So
Mhm.
it's open to the entire state.
And most of our work is in Texas, but we've done work with LA County's Department of Health, and also I've got an active partnership with Minnesota Public Defender's Office, and we've done work with Ohio's Public Defender's Office, and also I mentioned Haiti. We've been doing this work in Haiti for some time.
Mhm. So a lot of literal ground that you all cover. And also Texas is not a monolith. Rural, urban, city to city, you could go all day on that. So there's something for everyone, in our audience here to learn, from your lessons or from things that you're hearing, seeing, feeling, in your experience. So the first question I'm gonna throw out to you has to deal with kind of what kind of new challenges have emerged over the last 5 years, especially with the policy shifts. You could take climate shifts, you could take, office shifts, like different things like that. But how has this shifting environment affected the way you operate? And if you want to get granular with it in terms of like staffing, operations, strategy, public engagement, whatever calls you, can you tell us what are the biggest new challenges?
You can start since I have the microphone on.
Mm-hmm.
So I feel that it's kind of like so many questions within one. So I'm going to address just a couple of them. And if there's questions about that, of course, our audience can shoot a question additional. So for clarification. So I feel there is number one, our organization operates in trust. So that's why it's actually based on trust, is how we serve our community. And we don't, that for the community health workers model, we don't change. We can change. We are from the community. We serve our communities. So that has not changed. But the challenges that we have right now have arisen enormously. So that's one of our biggest adaptation. In the last 5 months, we had to check what funding has been cut left and right, right? So that's one of the biggest challenges. And but again, for community health workers, the way that we have in our organization, we are all of us contributing. And believe it or not, for some of our community health workers, 5 hours will make a difference in their families. So we put that in place when we started COVID, and it has worked in this last 5 months that we have a lot of cuts. So staffing, we don't want to say we're laying people off, or but rather being more smart about it and see not just centering in where we used to look for funding, but other ways. And of course, collaboration works a lot. That's for us.
So do you have a staffing structure that supports the community health workers?
Correct.
Is that right? And so when you talk about layoffs, you're talking about your operations staff and
Correct.
the
So,
community health as well. Okay. Okay.
so we prefer not to have layoffs, but
Yeah.
rather everybody, adapting and see where we can have be more focused in other fundings that are available and
Mm-hmm.
doing some other things. And
Mm-hmm.
I can explain more about it actually.
How has it been communicating that with staff? Is everybody kind of feeling the crunch? And like, what is it? What's the communications look like?
So, since it was actually a community health worker led organization,
Mm-hmm.
everybody sees, and we're completely transparent, what is coming in, what is going out, and who can be the best person for each of the projects. So when we see that, well, this project is coming to an end, or they pause that funding and we cannot continue, and ourselves we say, okay, we can go on this other project, or we can help something else, or we can add some more hours from another job. So again, we're not full time, but the experience of learning and having continuing education is a big motivation to continue to be part of the organization. So some of our community health workers, they don't have, they're just new, or they're a completely new environment for them in public health. So the going back to the workforce is a wonderful is very rewarding for some of us, right? So That's why they like to stay, even though when the hours having the income has been lowering a lot for all of us actually. So it's okay just to continue be part of a team. The sense of belonging is very truthful, as at least in our organization.
Thank you for sharing that. I felt it when she talked about trust and transparency and this, collective together. Like sometimes when it's quiet, like all the stories start, especially in this environment. So thank you for lifting that and how you're working. To my other colleagues, Aurora and Sean, what's been happening?
Yeah, I love this question. It's been um, a real tension for me and my organization. I think when I think about just a few years ago and the pandemic sort of broke our country open and our world in many ways, um, it was actually a moment of profound crisis, but it felt like a moment of profound possibility for our organization and for our movement, for healthcare for all, for health justice. We, our country felt like it was in the latest iteration of this sort of justice reckoning, and organizations were putting up racial equity statements, and our organization actually received lots of dollars to run our Generation Vax campaign to promote the vaccine to young adults, and we won this big award for the campaign. And it just felt like we were making a real shift toward health equity in really concrete ways, and ways that our organization had been calling for like 10 years. And it felt like those things felt really concrete for the first time, even though it took a crisis for a lot of our demands to come to fruition. And now today, we're seeing a real chilling effect among our partners. Programs are being defunded. A lot of our university allies, because we work heavily with students are a huge part of our base, are really being silenced. And it feels like a lot of our policy progress has completely been backsliding. And so there's just been this interesting tension, right? Like we internally and amongst our partners and even funders are being called upon to really shrink our mission and shrink ourselves and shrink our staff. But our base is actually calling us to be a lot louder. And so we are wrestling with this really critical tension right now between like what our base is calling on us to do and what we're calling on us to do. Like literally a partner the other day was like, okay, we want to work with you. When are you going to take the word equity off of your website? And then we've got, our young staff. This is primarily Gen Z and millennials on staff, and our base who are like, we want more in-person opportunities. We want to see Young Invincibles go bolder on these things. We want to see much more creative tactics, right? So we are in this like really, I call it a creative tension, because like how do we how do we do this without the money to do all the things that our base is asking for? So that's the space that I'm in, and it's a real challenge. We always want to listen to our base and listen to our young people and let them lead. And so we have done this really great webinar series. We called it Young People versus the Billionaires. We came out really bold around the big beautiful bill and all the sort of health cuts that are coming our way. We introduced what we're calling power shift retreats, where we're taking young people on a retreat to like, let's talk, let's connect, let's be in community, let's figure out where we go next. 3 days in the woods, let's do it. No more in virtual stuff. They want to be in person. They want to get offline. They want to strategize. And so we're trying to meet our young people, but we've also have so much pressure on us to shrink in ways that I have never seen before. When just 5 years ago, it was like, go bolder. We're all talking about equity. We're all in this work together, and now we're being tasked with that. So I don't have an answer. It's a tension that I have to manage. It's not a problem that I can really solve.
Okay, how many people want to go to the retreat in the woods to do the power? Okay. Go ahead, Sean.
Yeah, I hear you too, Aurora, about this is a problem you're in. That's not one that you can solve. I mean, if that's I for my organization, I guess I'll say that we're not a traditional public health institution. I think we've kind of been called to it It started for us back in 2017 with a hurricane here in Houston with Hurricane Harvey, and being a part of a sort of an unlikely part of a response, a mental health response there that I think once we got to the pandemic and there was a major crisis that was broader, we had we had a model. We had the beginnings of a model of a way to step in and do things that were below the clinical threshold, but were supportive. And it actually happened for me personally, along with the organization. We had a really big uptick of a need for support from healthcare, from traditional nonprofit organizations, social service organizations, and others to just provide support for their staff. One of my experiences during 2021 and a chunk of 22 is being embedded with the county public health department and working with everybody from their middle level, their epidemiologists, up to the actually I did anyway I worked with the whole organization in different ways. And what we saw again and again and again and again, and I don't want to when you use the B word I was burnout, is the tremendous load that the humans trying to address a problem that was far greater than their personal resources or their organizational resources, the tremendous personal cost for those people. So as an organization, what we've done, and I would say this is what we've done, is we've shifted to more educational models that are more dialogic, that are people getting in a circle and having a conversation about their experience rather than talking at them. And we also, and I'll say too, that local funders are starting to pay attention to this. And it's the great tragedy of what's happening with the Trump administration is that, local funders have told me, hey, this is a complete catastrophe for the mental health sector. And also, we're going to have so few resources that doing things that are more community based, that are subclinical, that don't have the costs associated with that, are maybe going to become more appealing. So it's the kind of terrible opportunity nobody wants, right? But I do think that at least on a local level, there'll be an interest in doing things that have broad reach at low price points for the funders. We'll see how that plays out. See if that translates into checks being written. They haven't been yet. Yeah.
No, thank you for that. And it brings about this, this one question that you all have gotten that talks about like what is it like to, kind of establish and continue trust and alignment or conversations with funders or supporters during this time? Like what's been working, what's been your experience, in the context of the shifting landscape. So do you have anything else to offer or say about that? Like, because I feel like you started talking about it, but is there anything else you want to add? Not the funding and support.
I can comment on it. Donna
Hmm.
and Aurora, I'm sure will have more to say. But for me, we're not an organization that we weren't sitting on big federal grants, or state grants. So we have city funding and we have private funding and other things. So the first wave didn't impact us. We're waiting for the second wave, which is, and our fund, we're already seeing it. So we've seen funders who had promised or led us to believe there would be large gifts coming, who are slowing their roll a lot. And so we know this is pretty well documented that the funders are taking this wait and see stance. And so we're communicating as best we can with our funders, but we get this message again and again and again, the institutional funders, this message that they're not going to do anything. They're staying within their existing budgets. There's not going to be a big push into new initiatives right now, and it's very frustrating because, of course, this is when we need the funding right now.
Yeah, definitely want to echo what Sean was saying about the frustration of the wait and see with our funders as well. It's something we've definitely been reckoning with. We've had some really great funder partners who have pushed out emergency funding for technical assistance around, legal and psychological safety. And so we've had some really great partners there. I think to kind of get at the question around how do we maintain strong relationships with our funders, we have tried to meet funders' hesitation with vision. We're trying to move our funders out of defense and talk to them more about a longer term agenda, a longer term strategy. And um, folks have been receptive to that conversation. They've been pushing back on like metrics. Okay, how do you measure something 2 years out? How do you measure that you are doing all this table setting and vision setting work? But we have been able to have some success with like trying to move our funders out of this defense mode and actually don't fund us right now to do rapid response, even though it feels like that's what we really should be doing. How can we in this moment get out of that cycle and design bold possibility driven futures and design the coalitions and the base building and all the things that we need to sort of make our dreams in 2 and 4 and 5 years possible. How do you fund us in a way that you believe we can actually win, right? And those are some of the kind of conversations I'm having with funders. And then honestly, I'm also saying equity work and health justice work can't pause just because it's politically unpopular, and just being, really direct. And I think we've had a lot of success when we bring young people directly into conversations with funders to like rehumanize the work. Because when you're doing policy advocacy, it can feel really wonky and people can forget that these policy solutions that we're advancing have real impact in young people's lives. And so we've seen some movement and some success there too.
Use that word vision, you know. And it's one of the things which, and you also talked about rapid response, right? Which is kind of like, I feel like we've talked about this kind of binary a little bit, that like there is urgency that's happening, life and death stuff, fear stuff that's happening in our communities with our workers, with people at the intersection of being workers and the communities that are getting hit, and vision. One way to get out of this is hope, vision. Let's be building towards something bigger. So how are you, and thank you for laying it down a little bit of how you're navigating it internally and with funders, or starting to aurora. How are you all navigating that kind of rapid, those things, those multiple. I see Donna reaching for a mouse.
Um, so again, for me, this term goal or long-term goal started about 20 years ago, 2 decades. So I'm old, guys. So, but and when I was in research with one of our local universities, we included community health workers. And at that time, there was no certification, no nothing. But here in Trust, I started seeing the possibility if the movement will be the people, the community, right? So that's what we did. The concept of Trust CHW is that we advance the health professionals and but our own health professionals, and through research, education, and also involvement and being there with the community. So what we dedicated the focus of the CHWs in our work, striving for social and health equity, because that's where we became from. So this organization really belongs to the people and their communities. So really, when just like Aurora mentioned, um, it was very much when the resilience took everybody's resilience, it took shape with COVID. So, and especially community health workers, they were at a great time for them to, the circumstances to be included in the healthcare delivery of care in the United States, including them. That's when they said, hey, the sense of community, and they belong to a community and they are the community. It was very complex. So when we're talking about long-term goal, we have been working for a long time. And now, when they're thriving to this complex system, changing system, because you have one thing on one day and the next thing changes that same thing. And now are helping matching resources that are available from other organizations. So this long-term goal for us specifically was to have them include all our CHWs in the delivery of care in the healthcare system of the United States. And, you know, they're very fighting workforce. And that was the long-term goal. And I don't think we're going back. There's no way they can take that force and say they don't belong here. Because it's like, well, we are part of a community. We are the community. We cannot just disappear. So that long-term goal, we had it. And I remember getting together with friends, and we won an organization led by community health workers. That's our long-term goal. So everybody, funders, um, employers can know what a community health worker can do. But it's taken us a long time. Other countries, they have them, right? Why are we always last? If we are, we should be number one, right? But you know what? It's taken us this long-term goal, navigating through a healthcare system that really is not well in place. So why we keep doing the things that they haven't worked, and or we want to go back to something that it didn't work, right? So we just have to adapt and continue to be resilient. Okay, we are here, we're not going anywhere. So kudos for our CHWs and everybody that believes in health for everybody. Mental health is one of them. I mean, it's just, we have a shortage and providers for clinicians and everything for mental health. We all need that. So I think we're here to stay in we cannot work in silos anymore. We can't. And that's why I guess we're here, all shapes and points of views in this panel. So thank you again for being here and being part of this panel.
You dropped a whole bunch of knowledge on that. So I'm gonna let everybody take a deep breath and let that marinate, all of that wonderful, powerful, just thank you for that. Thank you for all of that. Um, and this is our pause to let the audience know that if you have questions, please drop them in the Q&A section. I'll be taking a look along with Suri and Donna from the We Collab team. Thank you so much. Shout out to the Hub Squad, and everyone who's in the back making sure that this panel's happening because, no invisible people around here, right? So with that being said, there was a lot that was in there about resilience and strength. And a lot of times what comes with that is kind of hard work. Sean said the nasty B word, burnout. Um, right. And all of these things, because there is this push-pull of all of it being deep in this purpose and seeing and vision and caring and all the things happening. So can you all share your thoughts on kind of self-care, workplace wellness, resiliency? Like how are you taking care of or thinking about like the souls within your space or in the communities you serve or yourselves? Because as leaders, kind of on this call and people, it's like how do you take care of yourself? Like what would you like to share? And I know, Donna, thank you for mentioning earlier that sometimes we drop these really long questions with a lot of things. Y'all could just pick one of the things or none of them and go a completely different direction. I'm sure our audience would love to hear any of it. So go for it.
I think, Aurora,
Yeah, you go ahead. You got it, Sean. I'll just real quick. I love this question. I just wanted to say that, and I think everybody in this chat and this conversation knows this, but nihilism and doomerism and doom scrolling is, one of the worst things you can do for yourself in the coming months and years. And that hope is just a discipline and a practice. And so one of the things that I do very small is we talk about with our young people, it's like, tell me a story about a person who made a way out of no way. And like, we'll just like share stories around that, or we'll do shout outs to each other. We'll tell stories about how another young person in our base inspired us. Like every week, we make a dedicated space to just talk about our wins and what's been inspiring us because we just feel like hope is a discipline and it's a practice. And so we practice it every week at our staff meetings, no matter what. And I pass it over to you, Sean.
You just drop the mic there. I think that answered the question. Since I use the dreaded R word, resilience, yeah, I'm ambivalent about resilience. I'll tell you a little bit about that quickly, and it sounds like others are too. So resilience is a word that ends up getting used to tell oppressed people or exhausted people that they just need to be stronger, right? So essentially, resilience is strength, and it's strength developed through adversity. And the I have a lot more thoughts about it, but what I will say is that I found out there's a researcher. She happens to be here in town. She's wonderful. Her name is Danielle King. She's an organizational psychologist at Rice, and she has a lab called the Working Lab that is devoted to working on resilience and actually equity issues. So I do commend her work to you. But she makes a distinction I find really helpful, which is between adaptive and maladaptive resilience. And maladaptive, so if resilience is continuing to pursue a goal in the face of adversity, then maladaptive resilience is continuing to pursue a goal despite facing adversity in a way that harms you. Okay. In a technical sense, Danielle would say, continuing to pursue a goal despite facing adversity in a way that keeps you from meeting higher order goals. Okay. And adaptive resilience is an ongoing evaluation to make sure that what you're working on now is in line with higher order goals, like survival, like not experiencing burnout, which very briefly is an inability to function the way that you want to based on a failure to meet unrealistic goals that come from within us and from the systems of which we're a part. If we're drawn to this work, often we have the highest goals for ourselves in terms of our service to others. And the systems that we're a part of are so wildly under resourced that they are just by default going to ask far more of us than we can actually do. So, burnout is always around the corner. And I think the fundamental practice here is continuing to make sure that the work you're doing isn't harming you, continuing to review on an ongoing basis. And yeah, I have a lot more to say, but I'll stop there.
Phew, the work that you do isn't harming you. It's quite a thing. I see everybody's like, "Oof." Everybody take a breath on that. It's a little bit more than everyone. A lot of people use the flight attendant, put your mask on first, kind of thing. And I love the nuanced conversation around it because around resilience and brilliance and all of these things. Because, like, look, someone told me one time that every Black person in the United States is a whole miracle, you know, and that's because of resilience. The kind of Merriam-Webster definition is the ability to recover from or adjust easily to misfortune or change. And I like this idea of kind of thinking about maladaptive versus adaptive, and that for many of our communities it's the brilliant strategy that allows people. I mean, pandemic response was happening in kitchens and communities before a lot of the government White House stuff was happening. So to be clear, there's a resilience that we respect and that we need to regenerate and pour into. It's when someone with privilege and funds, and I'm thinking of the monopoly kind of money man, says you need to be resilient. It's like, get out of here. I'm sorry. I'm on. Let me get back into moderator mode. Okay.
Preach, preach, preach.
So, so yeah, thank you for, and we'll keep talking about resilience and self-care and whatever comes up, you know. Anybody else have anything to say on that before I get to a audience question and other questions? Okay, rock on. So there's a question about the role of community partnerships and collective action to sustain and strengthen your work. So how have you all like, and you've mentioned part of it before me, and I feel like Trust CHW is community. You know what I mean? Like it is at its core already, you know? That'd almost be redundant, but are there different ways that you all have engaged community partnership, collective action, civic engagement, whatever it is, to respond to the things that we've listed, you know, as challenges for like either now or in the past 5 years? What's that like?
Well, one of the things that we believe in, again, all the communities and health workers that they come to be part of our team is not, like who has the higher rank, and all of us are equal. And but there's one person that says, I really want to make sure that everybody gets along. And we played exactly the same rule with our partners and collaborators. So respect and loyalty. That's something that it takes a big part of continuing developing and fostering the partnerships and the collaboration that we have. Something that we believe to have a sustainability and is that they can believe that what we're doing is really to serve others, and whatever comes into our organization goes back to our community. So very important, because we want to make an economic impact from the inside out. So if we have a win-win relationship with anyone, and we start that culture within our team, then it's contagious, right? Knowing that, you know what, we're going to have a little piece of this cake and you can too, let's play together. So that culture that everybody is a winner, then from there, we can make a positive impact in the community. And that impact can be health, can be education, can be resilience. I mean, whatever it is that the community is looking for, then we have to be the mirror of what we want to happen to our communities. So if we are good to ourselves, then I mean everybody can have that, right? So it's a win-win relationship. So again, respect and loyalty. So we can talk transparent, very transparent. We can be very transparent with our funders, with our collaborators, with our partners. Say, you know what, maybe we cannot do this, but or maybe we want to see that you could do this or help with that. And then be upfront in saying, this is where we are. Can you help, or can we work together? So again, respect and loyalty, it's a lot to strengthen those collective actions that we talk about and sustain them. If we can trust in each other, and not that one day, I'm not happy with you, or I didn't like how your hair looked like, or whatever it is, that, yes, I mean, we are humans. And that's what, at a very basic level. I mean, some days I am not gonna be feeling very happy, and maybe that's your day to feel happy. So we can communicate that. Communication goes along, so we can have sustaining relationships. Communication, be transparent. Yeah, it's okay. Can keep going, moving forward. Communication with respect.
Hmm. So can you imagine we're already 45 minutes into this wonderful conversation? Um, and so I'm gonna drop a couple of more questions to you. And they're kind of around your tools for mental health. People want to hear more about a couple of things that you said, and then we'll kind of end a little bit on whatever your mic drop or last thing you need to say is, but also what gives you hope. Excuse me, that into my right. What gives you hope? I should give that all the air, right? Like say the word hope. Um, so the first question, I'm gonna ask is, we've spoken around it. I think some people have already given tools, but can you share and thank you for the turn off the doom scrolling thing, because I've had to put my phone in other rooms. I had to just, and I'm a political strategist too, so it's rough when it's your work. And you know what I mean? It's I have to call on my kind of on-call days, my 24/7, delivering babies and healthcare days to kind of tell myself to shut it down. There are other people in this work that'll handle it for you. But what are other tools that you have, like in terms of practices that you use as leaders to restore mentally, physically, and spiritually to help you keep showing up? Just help you be human.
I mean, I'll talk a little bit I'll talk personally and maybe from a team standpoint. So I'm in a very, I recognize just how much privilege there is that accrues to this. I am on day 3 of a sabbatical. And basically I hit, yeah. So I hit a wall back in February, and I basically went to my board president and said, hey, there are 2 choices here. I've been director of the organization for 10 years, and I either need a solid break from the roles, or I need to transition out into private therapeutic practice. And it is about boundary, and that's something that as a leader I'm fortunate to have. Right, I have the capacity to go and argue for myself and have standing. My board was very supportive, and so we don't all have that capacity. However, I just bet you that most of us as leaders have come nowhere near to using all of the vacation days that are part of our arrangement. I'll say this is maybe a little bit to the negative, but by way of underlining how important it is. So during the pandemic, the person who was in charge of our public health department told his team that he didn't think he was actually going to survive the pandemic physically. And he ended up leaving the job not too long after that and did survive, I'm very happy to say. But I say it just to underline how crucial it is for leaders to be attending to their own needs, and boundary. What are the times when might get your phone to turn itself off, right? Get your phone to, you can create settings so that it doesn't disturb you during certain hours. Don't send emails in the middle of the night. Don't, for yourself as much as for your employees. The last thing I'll say really quickly about team stuff is, and I really heard it in Aurora's reflections, was that giving yourself permission to feel what you're feeling and to express that, and to create a space in which it is expected, not as a job requirement, but as an affirmation affirmatively, that we are feeling things. This work affects us as human beings, and we need a space to talk about it. And it's not therapy. We're not therapists for our employees, but we are deeply interested in their humanity. During the pandemic, I would say that we would not send nurses and doctors into a room with a COVID patient without PPE. Remember PPE, personal protective equipment. We, we do send our people into psychologically hazardous work all the time. And part of what PPE looks like for that is processing. It's having the space to talk about what the effect is on us as human beings. I have a couple book recommendations too, but I'll throw them in the chat.
Yes, please throw those books in the chat. Sean, that was amazing. I think the only thing that I can even possibly add to that, do all the things Sean said. And I think the point around having, there's a certain privilege that comes when you are in a leadership role in your organization. And so we recognize that as well at Young Invincibles. And so what we did was we implemented a week of rest at our organization. And we said, you know what? Yeah, everyone can't take a sabbatical, can't take that time, or don't feel comfortable. There's a power dynamic. So the whole organization is going to shut down. We're going to make you do it. And so that's something that we did that's been very, very successful. People look forward to it. And it's like we're giving everyone permission at the organization to sort of like take a week of rest. And we're really excited. We've been doing it for about 4 years now, and it's been really amazing.
So we have one question about these power shift retreats that like everybody wants to attend. So Ashley Jones, one of our viewers, says, I was really intrigued by the mention of power shift retreats. How are you seeing those spaces reimagine, to reimagine leadership? Or how are you seeing those spaces? And if
I
you have
love
other people, I love the idea of the sabbatical. I love all of the like, yes. So
Yeah.
please.
Yeah, one of the ways that we're using that space to reimagine leadership is we have young people who've been in our base for a couple of years be camp counselors, and they do a lot of the offerings at the retreat. So one of our young people did essential oils, and she's indigenous, and so she taught us about the like indigenous practices around herbs and aromatherapy, and we did like a whole essential oils practice.
Mhm.
One of them is a yoga practitioner and sort of taught us that. And so we really took a step back and let our young people who like been in our base and been in our work for a while like flex, right? And like do some really great offerings and actually like step up in their leadership. And so that was a really cool way to kind of like have intergenerational and shared leadership in this space around those 3 days. And then we did some skill sharing, right? Like if you came to the space and you're brand new and there's something you want to offer, like you can bring that too. So that was one way that we did that. And our young people were like, we got to get offline. We want to turn our phones off. And we know that like, you know, all these like TikTok CEOs and they're watching us. So we want to get offline and strategize. And so that was a really big piece of it too, and just having that sort of like disconnection. But I will say if you're thinking about organizing them, making sure that there's space for young people to show up, show their leadership and facilitate. They're excellent facilitators and sort of like what do they think other young people need right now to like be in that space. I would definitely say do that.
Okay. So here we are with 7 minutes. And so I feel like let's do a little bit of a round of, well, actually, I feel like joy and hope. Almost a little bit of what brings you joy because, Sean, you talked about you kind of intersect with the arts in terms of some of the thing. And I feel like, art, music, medicine, food, like all of those things. So if you want to drop your kind of what's bringing you joy or what's bringing joy to your team or your community as medicine for this work, please do. And also what gives you hope. Um, yeah. And then drop your, check out our website at blah, 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 blah. Okay, go ahead. I'll
Right.
call. Go
Took me
ahead,
a
Sean.
minute to
Sean, I got the
took me a
mic.
minute to
Go ahead.
unmute. Sorry, y'all. Um, joy and hope. Yeah, it's interesting. I felt well, this was a metric for me of how burned out I was that I was no longer able to read fiction and really not able to watch hour-long dramas on TV. And it was kind of hard to watch movies. I could do it. Sometimes I teach with film. So it was an important metric for me actually of depression that I'd lost that capacity. But I just as a team, the Young Center team, we really lean hard into what we call the expressive arts, where what's important is the process and not the product. So, and we use it as a tool for emotional expression. That sounds fancy pants, and it's much more fun, much more fun than that. But we, as a team, really lean into that. And yeah, Carl Jung was the namesake of the Jung Center, and one of the sort of foundations of his view of the human psyche is that creativity is non-negotiable. It's necessary for human beings across the lifespan, no matter who you are, no matter what kind of artistic gifts you have. And I always find that refreshing, resetting. For me, it's photography, and that's an essential part of my time away now. Is that I'm going to leave on Sunday for a month-long camping trip by myself, and I'm taking my cameras with me, and I'm just going to spend time looking, right, and not being the director and not being a psychotherapist, and just looking and trying to be um, close to the natural world, which is always sustaining us, right? There's really good research about spending time in nature, and its positive effects on us as human beings, and that's always fills my cup. It always is. Maybe more so when I'm not in Houston in June. uh, I'm going to the mountains as fast as I can. I'm going north, but even still.
Okay, we have like no minutes left, but I'm gonna be short, Aurora. I have joy. What brings me joy is really be seeing people happy and with their families. And believe it or not, I love to see my community health workers loving data. What is important to them? I know it's crazy, but you know what? It's what our funders need. And it's okay to reach their goal and knowing and having all of these trainings. And it's giving me that sense of, well, I get it. I am a public health professional too. That's beautiful when they are so, take on their role. And so that's what I enjoyed really. So it's crazy me. Sorry.
No, I'm with you, Donna. I like to win. That makes me happy too. When young people win, when we win a campaign, we won 13 million in Illinois for the Mental Health Early Action on Campus Act. So college students getting access to mental health services and support. So I like to see young people win. I'm with you. That's what makes me happy. But outside of work, I feel my cup feels really full when I'm with my friends, when I'm with my family. I'm like, oh yeah, this is what I'm fighting for. Like, oh duh. So I would say like that is what fills my cup. I'm going to the Beyonce show with my friends this week in Houston. It's about to be crazy, Sean. So I know you know. But yeah, I think that's what's been filling my cup, just my community, friends, and family.
Well, folks, this has been amazing. I've picked up some gems. Hopefully, you have as well. Um, we have a list of books that I know our beautiful Hub Strategist team will send out to folks, or we'll put in the notes or somewhere. I see The Light Makers Manifesto by Karen Walron, Pleasure Activism by Adrienne Marie Brown, Real Self Care by Pooja Lakshman. Rest is Resistance. I love the Nap Ministry. Shout out to Nap Ministry and Trisha Hersey. Restorative Justice Practices, Circle Keeping by Ruth Ifakimi John Noel, and Emotional Justice by Esther Armah, and, you know, and so thank you all for sharing everything. Shout out to the Hub strategists for keeping this going, and take care of yourselves and rinse and repeat. um, Thank you, panelists. Thank you so much. Take care.